This is the time of year when many high school and college students will have those wisdom teeth finally pulled. Many of them will get opioids to deal with the pain. But there are other choices. If you or your child is preparing for surgery, it's good to know the options. Oral surgeon Dr. B.D. Tyner is here to tell us more. Welcome, Dr. Tyner.
Thanks for having me, Kayla.
You bet. Well, managing pain for patients is a big concern for healthcare professionals, especially in light of what's considered really an opioid epidemic. So how is this impacting the oral surgery community?
Well, Kayla, we know that in 80% of the cases, young adults' first exposure to opioids is when they have their wisdom teeth removed. And if given the choice, 70 to 80% of these patients would choose a non-opioid alternative to managing their post-operative pain. And that's important because in recent studies from academic pain management centers, they've shown that patients who are given opioid prescriptions, at least 10% of those will have an abuse or addiction problem.
You know, a lot of people might not be familiar with the alternatives. So what medication do you use in your practice?
In my practice, in the last 9 months or so, there's been a new drug introduced to the oral surgery market, and it's called Exparel. And Exparel is a drug that's similar to Novocaine. I'm sure all of your listeners out there have had their jaw numbed at some point in their life to have a filling done by their dentist. Exparel is injected in the surgical sites at the end of the case while the patient's still under sedation, and it provides long-acting pain relief during the post-operative period for these wisdom teeth patients.
Now, you mentioned this, that a lot of people, especially young adults, their first exposure to opioids comes following an oral surgery, like having their wisdom teeth removed. So if this is something that a student or a parent knows is kind of coming up this summer, what do they need to know going into it to help with pain management?
Well, what they need to know is there is an option now to manage your post-operative pain without having to take opioids. So I would encourage caregivers and patients who are contemplating the surgery to, at their preoperative consultation appointment, to have a frank discussion with your surgeon about your pain management, and what alternatives I have to managing that pain without having to take opioids.
I think we've heard a lot about opioids in the news recently, and this is kind of an issue that's gaining steam, but some people might think, oh, this is the medicine that the kids have always used. So are more and more people, are you seeing an increase in patients asking about this?
Well, as the opioid crisis has gained traction in the media, you know, you can't open up a newspaper or open up your email or turn on the television without seeing 2 or 3 stories about the opioid crisis. So more and more people are aware of this, and more people are starting to ask, how can I manage my pain without having to take opioids, or without my child having to take opioids?
Well, I think the information is the most important first step. Do the research. Where would you send our viewers if they want to learn more online?
Well, there's a great website called oralsurgeryprep.com. I would encourage patients and parents and caregivers who are planning on having this surgery this summer, go to that website. There's several questions on there that are suggested. I would encourage you to download and print those out, take those with you to your pre-op consultation, and have a real frank discussion with your surgeon about how to manage your post-operative pain, and more importantly, how you can manage this pain now without having to take opioids.
I think it's been about 15, 20 years since I had mine out. I still remember. Thanks for your time today, Doctor.
Thank you, Kayla.
You bet. Mike, we'll send it over to you.